So, what is sulfamethoxazole-Trimethoprim? Well, it's a combination of two antibiotics, sulfamethoxazole and trimethoprim. It's used to treat a wide range of bacterial infections, like middle ear, urine, respiratory, and intestinal infections. It's also used to prevent and treat a certain type of pneumonia called pneumocystis-type. It's important to note that this medication should not be used in children younger than 2 months old, as it can lead to serious side effects. It's also important to remember that this medication only treats certain types of infections, and won't work for viral infections like the flu. It's essential to use this medication only as prescribed and to avoid unnecessary use or misuse, as this can lead to decreased effectiveness. When taking this medication, the daily dosage and optimal timing can vary depending on the individual and the specific infection being treated, so it's important to follow the instructions of your healthcare provider. In taking sulfamethoxazole-Trimethoprim, make sure to swallow it with a full glass of water, as directed by your doctor. If it upsets your stomach, have it with food or milk. It's important to stay hydrated while taking this medication to reduce the risk of kidney stones, unless your doctor says otherwise. The dosage will depend on your condition and how you respond to treatment. For the best results, take this antibiotic at the same time every day. This will help you remember to take it consistently. Keep taking it until you finish the full prescribed amount, even if you start feeling better before that. Stopping too early could cause the infection to come back. If your condition doesn't improve or gets worse, be sure to tell your doctor. If you experience nausea, vomiting, diarrhea, or loss of appetite, it's important to let your doctor know. Remember that the benefits of this medication outweigh the risk of side effects for most people. However, it's important to watch for serious side effects such as muscle weakness, changes in mood, signs of kidney problems, extreme drowsiness, or signs of low blood sugar. Seek medical help right away if you experience symptoms such as a headache that doesn't go away, seizures, or slow/irregular heartbeat. Rarely, this medication can cause a severe intestinal condition or other serious allergic reactions. If you develop symptoms such as persistent diarrhea, abdominal pain, unusual rash, or difficulty breathing, seek medical help right away. Prolonged use of this medication may result in oral thrush, yeast infections, or other side effects. If you notice any unusual symptoms such as white patches in your mouth or changes in vaginal discharge, contact your doctor. Keep in mind that this is not a complete list of possible side effects, so it's important to consult your doctor or pharmacist if you notice any other unusual effects. Before taking sulfamethoxazole-Trimethoprim, it's important to talk to your doctor or pharmacist about any allergies you may have. It's also important to discuss your medical history, especially if you have kidney or liver disease, blood disorders, allergies, asthma, low bone marrow function, or any metabolic disorders. This medication may affect the effectiveness of certain vaccines, so be sure to inform your healthcare professional before getting any immunizations or vaccinations. It's also important to let your doctor or dentist know about all the medications and products you use before having surgery. Sulfamethoxazole-Trimethoprim can make you more sensitive to the sun, so be sure to limit your time in the sun and take precautions to protect your skin. If you have diabetes, this medication may affect your blood sugar levels, so it's important to monitor your blood sugar regularly and inform your doctor of any changes. Older adults and patients with AIDS may be more sensitive to the side effects of this drug, so it's important to be aware of any skin reactions, blood disorders, or high potassium levels. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about the potential risks and benefits of using sulfamethoxazole-Trimethoprim, as it may harm an unborn baby. This drug can also pass into breast milk, so it's important to consult your doctor before breastfeeding if you are using this medication. When taking sulfamethoxazole-Trimethoprim, it's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Always keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with sulfamethoxazole-Trimethoprim include blood thinners such as warfarin, dofetilide, methenamine, and methotrexate. Additionally, this medication may interfere with certain lab tests, potentially causing false results. It's essential to make sure that lab personnel and all your doctors are aware that you are using this drug. As for the benefits, daily dosage, and optimal timing for taking sulfamethoxazole-Trimethoprim, consult with your doctor for personalized guidance on the best course of action for your specific condition. If someone has taken too much sulfamethoxazole-Trimethoprim and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, you can contact a poison control center for further assistance. In the US, you can call 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include severe nausea, vomiting, diarrhea, dizziness, drowsiness, and changes in mental/mood. Remember, this medication is only for your specific condition. Don't share it with others or use it for a different infection without your doctor's approval. If you're taking it for a long time, your doctor may recommend regular lab tests to monitor your health. Make sure to keep all your medical appointments and consult your doctor for more information. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Remember to store sulfamethoxazole-Trimethoprim at room temperature, away from light and moisture. It's important to keep all medications out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard this product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And please, do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.